Hello guys, today we will talk about congenital heart defects, and it's a subtopic when we will talk about cardiac system, vessel system, yes, and disease of cardiac. Okay, what about congenital heart defects? There are more than 100 different types of congenital heart defects. This group concept combines anomalies of the position and morphological structure of the heart and large vessels. In picture, you can see any kinds of pathology. It's interesting and more informativity picture, and if you don't understand something, you always can look to this picture and it will help you to have fast understandable of all cardiac heart defects. Anomalies occur due to a violation or incomplete formation, embryogenesis of the heart and large vessels during intrauterine, less often postnatal development. The frequency of congenital heart defects range from 5 to 8 cases per 1,000 newborns. In picture you can see stages of embryogenesis of heart. Among all heart defects of the interventricular septum are most common. Without surgical treatment, most children with congenital heart defects die within 1-2 years of life. Only 10-15% of them live for 2 years or more. My own history, I have a friend, yeah, he is very popular in Kaliningrad. His name is Ilya, surname is Khostov. He is a singer, yeah, and he have a cardiac heart disease. You can find him in Instagram, and he in childhood have had many operations in heart, and now he is alive and can sing, and you need to understand that it is normal practice in all countries that babies will surgery, yeah, or will operate it, and then they live like normal people. Classification of heart defects is quite complicated. In earlier classifications, according to clinical science, they were divided into defects with cyanosis, blue defects, and without cyanosis. Currently, clinically significant heart defects are divided according to the nature of hemodynamic disorders in the small circle of blood circulation into the following groups. We will show these groups in the next slide, and now please look to this picture. It's interesting. There you can see small and big round of circulation, blood circulation, yes, and there you see a percent degree of all blood, and look, in veins we have 60% of blood. You need to remember it in all situations, because It's interesting that in veins we have more blood than in arteries. That means that veins are a depot of blood. Okay. In arteries we have just 11%. In small circle circulation we have 12%. In big circular circulation we have 88%. Yes. In heart just 9%. In capillaries 7%. Okay, and now about classification. How I say it delayed for first defects with hypervolemia, second defects with hypovolemia, and third defects with little or unchanged blood flow. The defects of the first group, not accompanied by early cyanosis, include an open arterial bottle duct, a defect of the atrial or interventricular septum, coarctation of the aorta, and all of these defects you can see in left pages. This is a coarctation of aorta. You see the coarctation and word coarctation. There you can see open ductus, arteriosus. There you can see interseptal, intraventricular septum defect. Yeah, and there you can see forgot. Of interventricular septum or forgot. Sorry, I will remember just some minute. Okay, the duct, the defects accompanied by cyanosis include atresia of the tricuspid valve with a normal caliber of the pulmonary trunk and a large defect of the intraventricular septum, an open arterial duct with blood flow from the pulmonary artery into the aorta. This is observed with severe hypertension in the vessels of the small circulatory circle. We call it Eisenmenger complex. The defects of the second group, not accompanied by cyanosis, include isolated stenosis of the trunk of the pulmonary artery. The defects accompanied by cyanosis include triad, tetrad, pentad, or fellow, a combination of several congenital defects, tricuspid valve atresia with a narrowing of the trunk of the pulmonary artery or a small defect of the interventricular septum. The defects of the third group with unchanged or little modified blood flow in the vessels of the lung include anomalies of the aortic arch and its branches, absence of the aortic arch, stenosis and coarctation of the aorta, mitral atresia, atresia of the aortic valve, mitral valve insufficiency, and other rare defects. Some of these you can see on the picture. There are also combined defects in which violation of the relationship between different parts of the heart and large vessels are detected. In patients with defects of the first group, there is an intracardiac pathological message with a discharge of blood from the arterial channel to the venous. From the left ventricle of the heart and large vessels extending directly from it from left to right. Therefore, insufficient amount of arterial blood enters the peripheral arterial channel. Arterial blood. In the regard, children lag behind in physical development, often suffer from pneumonia. Their skin is pale, sometimes with an emphatically bright lip color. Pallor increase after physical exertion. All defects of this group are characterized by overflow of blood, hypervolemia, of the right parts of the heart and lung vessels. During the X-ray examination of the lungs, signs of hypervolemia in the small circle of blood circulation are manifested by an increase in the pulmonary pattern, expansion of the roots of the lungs, swelling of the pulmonary artery due its overflow with blood. Percussion and radiology determine the expansion of the right chambers of the heart, and you see these right chambers in right chambers. Sorry, I find picture with left chambers. Okay, this is my maybe the right. No, sorry, my mistake. Okay. If we talk about ECG, clearly shows signs of overload of the right ventricle, and there in thoracic ECG you can see just in V1, 2 and 3 hypertrophy of right chambers, gives right ventricle, because we see a deep S, very deep S, and it don't change. Yeah, deep. In normal situation, we see V1 okay like this, V2 like this, V3 like this, yes, and this is bigger, and then like this, but not like this, of course. Sorry. Diagnostics. Why there is a right there is a right ventricle, yes, and there is a left ventricle hypertrophy. Remember it in ECG. Diagnostics. Ultrasound examination, for example, echocardiography or color Doppler scanning of heart problem, as well as angiocardiography, confirms the dilation of the right parts of the heart, increased pressure and oxygen content in the blood taken from them. Diagnostics. These research methods allow us to determine the diameter of the defect, the amount of blood discharge. Having recognized the syndrome of overflow of the small circle of blood circulation, the doctor can choose from the group of defects with hypervolemia of the small circle of blood circulation the one that will correspond to auscultative and other symptoms. For example, systolic noise in the second intercostal space at the left edge of the sternum is characteristic of an open arterial bottle duct, and a sharp blowing systolic noise in the fourth intercostal space to the left of the sternum is characteristic of a ventricular septal defect. The second group includes defects in which there is a depletion of the small circle of blood circulation due to the difficulty of its release by the right ventricle into the pulmonary artery system, for example with pulmonary artery stenosis. Limited blood flow to the lungs is observed not only with stenosis of the blood outflow pathways from the right ventricle, but also with the discharge of blood from it into the system of the large circulatory system, discharge from right to left. This is usually observed with tetrad, triad, pentad or phala. With moderate narrowing of the pulmonary artery, children often lack subjective sensations caused by the defect, and children usually develop satisfactorily with a significant narrowing of the pulmonary artery. They experience weakness, fatigue, pain in the heart, shortness of breath during exercises. The color of the skin in such children is normal. Often there is a heart hump. During auscultation of the heart, a weakening of the wheel tone is detected. A loud, high-pitched systolic noise is heard in the second intercostal space at the left edge of the sternum in combination with a waking of the second tone. Here, during palpation, systolic tremor is determined. These symptoms are characteristic of narrowing of the pulmonary artery. Systolic tremor, pulmonary artery. X-ray and ultrasound examination reveal not only stenosis, but also post-stenotic expansion of the pulmonary artery, enlargement of the right heart, hypertrophy of the right ventricle due to constant increased systolic load. On an ECG, signs of hypertrophy of overload of the right parts of the heart are determined, and when probing an increase in pressure in the right ventricle and a decrease in pressure in the pulmonary artery, an increase in the pressure gradient. And in picture you can see ECG with hypertrophy of the right part of the heart. But we see this ECG before in another picture. But there we see how thoracic electrodes do a ECG. Yeah. This one. Oh, sorry. This one. Wall. This wall. This wall. This wall. This wall. And this wall. Yeah. Often, if professors ask you what wall for what electrode for what wall, yeah, you can always to draw this picture and remember all. You can remember all. Okay. Ultrasound examination as well as angiography allows to detect narrowing of the pulmonary artery, valve or subvalvular narrowing with post-stenotic expansion of the pulmonary artery. With combined defects tetraph of follow, there is a decrease in blood flow in the pulmonary arteries due to venous arterial blood discharge. The entry of a large amount of venous blood into the arterial channel leads to decrease in the saturation of arterial blood with oxygen. Patients from the moment of birth have cyanosis of the skin and visible mucous membranes, and we call this blue defect. Yeah, blue eyes, blue defect. As the disease progresses, the lack of blood flow through the pulmonary arteries worsens. Chronic oxygen starvation develops. It's manifest by uneven cyanosis of the skin and hands, thickening of the terminal phalanx of the fingers, shortness of breath, and rest tachycardia. At the same time, dyspnea, cyanotic seizures develop associated with spasm of the right ventricular outlet. The boundaries of the heart are expanded. As the heart increases, the chest is deformed, a heart hump is formed. Systolic tremor is detected above the heart area. A weakened second tone is heard on the pulmonary artery, and a rough systolic noise in the third or fourth intercostal space at the left edge of the sternum. The ECG shows hypertrophy of the right ventricle, and you see it. Ultrasound and angiocardiographic examination can confirm the presence of venous blood discharge into the arterial channel. Arterial vessels. A decrease in blood flow in the vessels of the lungs. At the same time, it is possible to measure the pressure in the cavities of the heart to determine the oxygen saturation of blood taken through a catheter. In patients with defects of the trial group, there are no symptoms of gas exchange disorders. The main complaints in such patients are fatigue, palpitations, headaches. Palpitations, of course. Palpitations, sorry. In patients over 14-15 years of age, there is an increase in blood pressure upward and a decrease in the lower extremities. And guys, if you really want to understand heart defects, I pleased you to look video of these guys. Real interesting, real understandable, real easy, and these pictures in this time, yes, I remember these pictures, and they really help me to understand this topic. And I pleased you to look this video in YouTube. I think you can find it, and it will help you better than my lecture. This is my mark of my lecture. Sorry. The skin and visible mucous membranes of the usual color. The apical thrust is strengthened. A systolic murmur is heard above the apex of the heart. The boundaries of the heart are expanded to the left. And in ECG, we see signs of hypertrophy syndrome of the left heart. Yes, and now we see and we look to the right side of picture, and we see that in all segments we see a big R, yeah, and not big S. Big difference there and there with S. The depth and nature of the pathology makes it possible to clarify ultrasound and angiocardiographic examination. For all defects, valuable data is provided not only by ultrasound Doppler examination, but also by rapidly introducing methods of magnetic resonance imaging. Okay, we stopped this topic, but after this lection you will have many small lections about every pathology, and I think those lections will help you. Thank you very much for your attention, and be healthy and don't forget about me. Bye bye. See you soon.